Joining me now, Dr. Michael Osterholm, Director of the Center for Infectious Disease Research Policy at the University of Minnesota. Dr. Osterholm, thank you very much for being with us. You've written a column in the New York Times with some very clear choices on how to crush the virus, as you put it. You've concluded that we need another lockdown. Tell everyone why.
Well, first of all, the world has demonstrated that this virus can be controlled in a much, much better way than we've done. And in fact, the city of New York and the state of New York has shown us that. And what happened in the spring is we locked down for a while. I would almost call it a slowdown, which of course many would think it was more than that. But we never got our numbers down to a low level where then we could fight them with the traditional public health tools that many countries around the world have done and now have allowed those countries to reopen much more than we have here. Until we do that, we're just going to see very high numbers that will continue to cripple us both from a health standpoint and from an economic standpoint. And so I don't think we really have any other choice but to do that if we want to get through the next 6 to 8 months in the best way we can.
And of course, the problem is that the White House, the federal government, is giving, contradictory advice and not understanding that the economy won't improve until the pandemic is at least controlled. And as you point out, that this is the only way. We're seeing super spreader events. They're becoming more of a threat. People are becoming too relaxed. We had that motorcycle rally, historic rally. This is not the year for it, for all those people to be in Sturgis, South Dakota.
Right. Well, if we give up before the virus doesn't care. It'll still just infect us. And what we have to continue to remember, I like to say we're right now probably in the third inning of this 9-inning game. Only about 8 to 10% of the U.S. population has been infected to date. That's it. And for this virus to slow down transmission, it's going to take at least 50 to 70% of the population to become infected or have a vaccine. But between now and the time a vaccine might be available, we're going to see a tremendous increase in the number of ill people. Remember back in March when 30,000 cases a day seemed impossible? Then we got it down to 22,000, but then look at it, went to 65,000. Now we're down, going to probably be in the high 40s, low 50s until the end of the month. When schools open, colleges and secondary education open, we're going to see an explosion of cases in September, October. They're going to say, remember when it was only 60,000 cases a day? That's what this country has to understand we're up against if we don't do these things. The virus doesn't care if we don't do them. It'll still infect us.
And parents are, of course, eager to get their kids back in school, but safely. Teachers are alarmed. Staff are involved. And now we hear that more than 97,000 kids tested positive at the end of July, according to the American Academy of Pediatrics and the Children's Hospital Association. How troubling is that to you, with all the pressure to get these schools back into classrooms?
What's really troubling, Andrea, is what's going on in the community. It's not just the kids being infected. In communities that have low levels of transmission, I think the schools, particularly for elementary school kids, can be opened much more safely. I think secondary schools are going to be a challenge. I think if you are at a college or a university, a technical school, or a high school today, you are going to be part of a significant challenge for the upcoming months. But as we've demonstrated with daycare, in our state here in Minnesota, for example, we've not shut down our daycares for the entire summer, and we've gotten through quite well. And so I think that the chance of having a better experience with elementary students, K through 5, is still a real possibility, but it's only going to happen in communities that have shut down transmission. So as a society, we have to ask ourselves, do we want bars and restaurants? Do we want our schools? Which ones do we want? It's our choice. And I think that's what we're up against right now.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.